I'm announcing today that Public Health updated their recommendation regarding the mandatory vaccination of the healthcare workers in Quebec. Vaccination of healthcare workers will therefore no longer be mandatory for current network employees, but it will be mandatory for all new employees. But it requires rigorous screening of all unvaccinated employees 3 times a week. Over the past few days, our partners have presented us with potential service reorganization scenarios where we have simulated the impact of the absence of the unvaccinated. To deprive ourselves of 8,000 people that currently will have devastating consequences for our network. We could face, for example, more than 500 reorganization or reduction of services. But I want to be clear. The measure that we put in place in the last few weeks will remain. Healthcare workers who are unvaccinated do not have access to COVID or retention bonuses. We also continue to require that unvaccinated workers be tested at least 3 times per week, both public and private. This is not negotiable. And we will be uncompromising for those who do not want to be tested. They will be suspended without pay, which is already the case in several establishments. I want to send a message to the healthcare workers who are not vaccinated. As workers in the health network, you have a moral duty to protect the clients that you treat and to protect your fellow citizens. You also need to show solidarity with your colleagues who may have to suffer an even greater shortage of staff if you find yourself suspended. With a vaccination of 97% of our health personnel, we are moving from a mandatory vaccination to mandatory screening. Thank you. Merci beaucoup.